Hello, this is Andre with Tongue Tale on Monday. And today's tale is about a tongue of a 70 years old patient who came to me with acute palpitations and anxiety. And the bouts would arise spontaneously, but typically at 5 o'clock in the morning, and they would be quite severe, so that she would call an ambulance because she was afraid that something is wrong with her heart. However, EKG did not show any physical damage to the heart. In addition to palpitations, she also has been suffering chronically from sleep apnea, and she also has sinus issues. Now, let's take a look at her tongue to see what tale it tells. Now, you can see that she has a thick, slippery coating at the root of the tongue, and the coating is also moist. So we're talking about here phlegm, dampness accumulation, probably due to food stagnation, because you can see it in the intestinal area building up so much. So this woman is probably not on great diet. She is consuming more carbohydrates, fast carbohydrates than necessary, and it turns into phlegm, stagnation. And the size of the tongue is slightly shorter than average, and there's also a little bit of gap on each side of the tongue. And so that indicates that there is a slight decline in kidney essence, which is expected of an older person. I don't think this is a major issue in this case. What interests me the most in this tongue is the shape. You see it's swollen. So there is dampness accumulation, and you can see also teeth marks on each side of the tongue. And so this is a severe dampness accumulation which comes from spleen qi deficiency. You see the color of her tongue is pale pink. That's a sign of qi deficiency. And most probably she has palpitations due to qi deficiency. You see, to see the status of this, to see the reason for palpitations, we need to take a look at the tip of the tongue, because this is the area that corresponds with the heart organ. And we want to see any pathological changes in this area, of which there are none. And so most probably this palpitation is caused by spleen qi deficiency, which turns into heart qi deficiency type of palpitations. Another interesting features of this tongue are the ridges here, which indicate that this person also has liver qi stagnation. And another important feature we need to differentiate is this midline crack. Now, the midline crack can be a sign of either constitutional weakness of the heart or decline in stomach yin. And I would tend to think this is a decline of stomach yin, because you see it is most prominent is in the middle 1/3 of the tongue. True, it extends a little bit towards the lung area here and towards the kidney area here, but you see the tongue is not red, and so there is no glaring yin deficiency which would create stomach, which would create heart fire and cause palpitations. No, this is a constitutional crack that caused by gradual decline in stomach yin, and most probably this is because this person has liver qi stagnation, which invades spleen and stomach, and over time this stomach invasion caused stomach qi deficiency and further stomach yin deficiency. Now there is also a little bit of heat building up at the tip of the tongue, so there is a little bit of heat harassing the spirit, and it comes from the liver. The edges of the tongue are slightly red. And so the overall picture, the way I see this tongue is we deal with spleen qi deficiency, which turns into heart qi deficiency, causing palpitations, and it's complicated by liver invading spleen and stomach, and also phlegm dampness accumulation in the intestines and also in the lungs, because remember, she also has sleep apnea and sinus issues, and these issues are due to phlegm dampness in the lungs. And she also has food stagnation a little bit here. So to treat this person, we need to use herbs to release liver qi stagnation, and we're going to use xiangfu, cyperus in combination with baishao, white peonia root, to release liver qi and also to relax it. Baishao is a very special herb to relax liver qi, and this combination is used when liver invades spleen and stomach. Next, we want to add an herb that clears heat. Gardenia zhizi clears heat from liver and gallbladder, and also clears heat from the heart. It's a very nice and calming herb. Now, to treat the branch of the problem, but the manifestation, we need to nourish the spleen and especially heart qi, and we're going to use zhenshen, ginseng, huang qi, astragalus, and suanzhaozhen, ziziphus, to nourish heart qi and also spleen qi. Now, spleen qi deficiency also causes dampness, and so we're going to use zhangzhu, atractyloides, and fuling poria to strengthen the spleen and transform and leach out dampness. We want to get rid of dampness in this person. And to treat food stagnation, we're going to add shen chu, massa fermentata. It's not an herb, it's rather an herbal powder, but very often in Chinese materia medica, it is represented as an herb that resolves food stagnation. So there you have it. This is the formula that treats palpitations due to heart qi deficiency. Now, if you experience palpitations or maybe anxiety and would like to know what your tongue tells on you, don't hesitate to send us your tongue, and we'll talk about it next time. I'm Andre with Tongue Tales on Monday, and I will see you next Monday.